You're listening to the Mari Mokonda Show on Salam Media. It is time for our Women's Health Tuesdays with Dr. Tom Mokaya, who is an obstetrician and gynecologist based in at Netcare Hospital in Johannesburg. So today we are talking about chronic pelvic pain in women. Yes, it can happen to men as well. So because it's Women's Health Tuesday, we are talking about women today. Dr. Tom is on the line. A good day, Dr. Tom. Thank you for joining us once again.
Hi, good day, and good day to your listeners.
All right, Dr. Tom, without further ado, when we talk about chronic pelvic pain, what exactly are we talking about?
Now, chronic pelvic pain is pain around the pelvis. And what is the pelvis? The pelvis is essentially the lower part of the human body, the area that is just below the belly button and up to the genital areas or below. That is a region that is called the pelvis, and it of course goes all the way to the sides and even to the back. So when we talk about pelvic pain, it's pain which is in that region. And the second word that is associated with that is chronic. There are two forms of pain. There's an acute pain, which comes suddenly, and then there's chronic pain. Chronic pain is pain which lasts for a long time. And normally we classify or make a diagnosis of chronic pelvic pain if the pain has been there on and off for at least 6 months and more. That is just the classical way of defining it. So any pain that has been there for 4, 5, 6 months and more, we call it a chronic pelvic pain.
So, what causes this chronic pelvic pain?
Now, there are many causes of chronic pelvic pain, and it's thought that almost 15% of women may, at some stage in their life, mainly at the reproductive age, complain of pain. And the causes of pain can broadly be divided into ones which are specifically associated with the pelvic organs, and one which are not associated with the pelvic gynecological organs. So the ones which are associated with gynecological organs include pain caused by these gynecological diseases like endometriosis, women who have fibroids, women who have had chronic pelvic inflammatory diseases, and women who have what we call as pelvic congestion syndrome, where the blood vessels around the pelvis tend to increase and they become distended, just like women who have what we call as varicose veins. So those are the common gynecological causes. The other non-gynecological causes include women who have problems in their bladder, which is around that area. Women who have problems with the bowel, the intestines. Here now we look at things like irritable bowel syndrome, chronic colitis, and women. What can cause pains at times is the muscles and the joints around that area, which we should not forget. And at times when we've ruled out all those causes, we find there are women who have chronic pelvic pain because of psychosocial disturbances. Theoretically, women who have probably been raped at some stage or having an abusive relationship, for example, can present with chronic abdominal pain.
What about pains associated to menstruation? Does that also contribute to chronic pelvic pain?
Now, pains that are associated with menstruation, which we call dysmenorrhea, which since it comes on and off and it comes at particular times of the month, they are not classically classified as chronic pelvic pain because those ones come on and off. So according to the definition, the classical definition of chronic pelvic pain is pain which is there continuously, and most of the time it doesn't come periodically. So that may, depending on which classification you use, that may or may not be used. But classically, dysmenorrhea or menstrual pain is not classified as a chronic pelvic pain.
Mm-hmm.
And
So
after we make the diagnosis, oh, sorry.
When should one be concerned about the chronic pelvic pain?
Now, chronic pelvic pain, after it has been there for a prolonged, pain is pain is pain. I mean, it does not go away. At times you try to ignore it, but it comes back. So if it has been there for a period of time, let's say 6 months, then one needs to be concerned. And secondly, if the pain is very severe and does not get treated with mild occasional Panado, which you take probably once a week and it does not go, then it should then one should be able to go and see a healthcare practitioner to try and find out what the cause of the pain is.
All right. Describe to us, what does the pain in the pelvis feel like?
Now, very good question, because pain is one of those things that unfortunately one may not be able to measure, like a temperature. You put a thermometer and then you get the 37.3, for example, then you know that this is. So most of the time, we ask the patient in their mind to grade the pain between 0 to 10. 10 is when the pain is very severe, and 1 is when the pain is very mild, and no one they forget about, then it goes away. So according to the classification, if the pain is between 4 and 7, and which means at times one can be able to manage it and one may not be able to manage it, then it's considered chronic pelvic pain. That's one thing. Secondly, we ask which part of the pelvis is it there? Is it right in the middle of the pelvis? Is it on the side of the pelvis? Or does it radiate to the back? Because at times one may have pain in the pelvis, which at times feels like it's shooting down to the feet, it's shooting down to the left or the right knee, or shooting back, or at times the pain can even shoot up to the stomach. So when we are trying to get a description of what kind of pain it is, we also ask those questions. And then we ask questions like, does it get worse during periods? Does it get worse when one either passes urine or when the bladder is full? Does it get worse when they go to the toilet to pass number 2, to pass 2? Does it get worse? So all those questions we ask so that we can get the character of that pain. And in the process of asking those questions, it also gives us an idea on which organ we may be dealing with and where the pain is, so that finally, when we are trying to treat the pain, we know where it is and how best to treat it.
All right. And are there any symptoms to be aware of? Because I mean, like we mentioned earlier, that menstrual pains are totally different and are not associated. But sometimes we might think that it could be menstrual related, but yet it is the pelvic pain.
Now, when we are trying to differentiate between those two pains, the definition is not really black and white, as it were. There is a lot of gray area in between. For example, chronic pelvic pain can be caused by endometriosis, and endometriosis also gives severe period pains. Women who have adhesions, for example, who had surgery before, can develop chronic pelvic pain, and that pain gets worse during period. Women who have fibroids, for example, can have pain which is sitting there, but it gets worse during period. So there is an area in between there of the causes that cause pelvic pain and the one that cause menstrual pain. Now that you mentioned about menstrual pain, characteristically, menstrual pain or dysmenorrhea comes during the time of periods, and it may come 2 or 3 days before and after periods. The pain goes away, and it's almost like acute because it comes, it's going to come, it comes, you deal with it. When the
Yes.
periods go, then the pain completely goes away and life goes on normal and everybody's happy, there's no pain. And then when the period comes, then the pain comes again. So that one which comes, and one could classify that as periodic chronic pelvic pain because it comes periodically and it's not there all the time.
All right, doctor. How is it diagnosed, and what is the treatment involved?
Now, the diagnosis starts from the history, just as I've described before. One needs to know the character of that pain, and then it guides you through which areas to concentrate. So, after the patient has verbalized or describes the pain, the next thing that we do is ask where the pain is, what makes it worse, etc., etc. That is the history that we want the patient to give us. And after we do the history, then we go to the examination when we're trying to make the diagnosis. Then one does what we call as a normal pelvic examination, which is the palpation, feeling where the pain is, which area it may radiate to, and feel whether there are any scars which may suggest previous surgery, or if there is a fibroid which one can be able to feel. And then after that, we do an ultrasound, we do investigations, we do pelvic examinations. And if there's a fibroid, for example, one can be able to see it and confirm it on ultrasound. If there's endometriosis, which has organized itself in the ovaries, then one can be able to see what is called as endometriomas in the ovaries. And that really helps in the diagnosis. And then if one cannot still be able to see that, as part of treatment and diagnosis, one may progress into surgery. And the commonest form of surgery that is done is a laparoscopic surgery, the so-called keyhole surgery, where we put in a camera into the abdomen and look and see how the abdomen looks like. And in 60% of cases, we are able to pick up whether it's endometriosis or fibroid or pelvic congestion syndrome, or we are also able to pick up if it's scar tissue adhesions which are attached to the uterus and which are attached to the ovaries, which are giving that pain. And during that time, after you made the diagnosis, we can at the same time continue and treat. If it's endometriosis, it can be treated surgery at the same time. If they're fibroids, they can be taken out at the same time. And there are instances where when one looks inside and one can be able to see particular nerves. And nowadays we are able to inject some nerve ablation compounds which block the nerves which supply the area that cause pain. That is if the problem is caused by a gynecological problem. In instances where the pain is caused by the bladder, for example, where one gets a chronic bladder infection. Now, that can be diagnosed by doing a urine test to see whether there's any bacteria there that needs to be treated with antibiotics. And in instances where that doesn't get better, we ask the assistance of a doctor called urologist who put small little tiny cameras into the bladder, and they can look at how the wall of the bladder looks like. And if it's caused by chronic cystitis, then they inject some drug into the wall of the bladder, and that very many times magically manages treatment, which is caused by chronic cystitis. And in instances where the pain is because of irritable bowel syndrome, which is not gynecological and which is caused by intestinal problem. In a case like that, we treat it in conjunction with doctors called gastroenterologists, where we manage the diet, we manage it by giving treatments which manage the IBS. And quite a number of young women do develop irritable bowel syndrome. And by managing their diet, by managing them psychologically, giving them psychological support, we actually manage to treat the chronic pelvic pain, which is caused by irritable bowel syndrome.
All right, Dr. Tom, that is all the time that we have. But thank you so much for making yourself available and for the knowledge that you share with us every week. Have a wonderful day further.
Thank you. Thank you so much for having me. Thank you.
That was Dr. Tom Mokaya, our OBGYN, obstetrician and gynecologist, who is based at Netcare Hospital in Sandton, talking to us about chronic pelvic pain in women, the symptoms and causes, the diagnosis and treatment. And you have to be really careful when you think that you have chronic pain or when you think that you just have menstrual pain, because there could be an underlying problem that you don't know of, like endometriosis, because endometriosis will also cause it will also cause you pain that feels like a menstrual cramps, but it's not. It's something else. So always get yourself checked out. Always visit your gynecologist if you feel like something is not right, like something just doesn't feel the way it felt before. Anyways, please send us your comments and suggestions. Leave them in the comment section on Facebook. You can also send them to us on WhatsApp on 0617 660 We will be right back.